front of leg with dorsum of foot. In this topic, we will cover important surface landmarks, major vessels and their pulsations, cutaneous nerve supply, deep fascia and compartments, muscles of the anterior compartment, and the key clinical anatomy, like foot drop. Let's begin. Surface landmark. Medial and lateral condyles of tibia are felt well in a flexed knee, with the thigh flexed and laterally rotated. Tibial tuberosity is a bony prominence on the front of the upper part of tibia, 2.5 centimeters distal to the knee joint line, passing through the upper margins of the tibial condyles. Head of the fibula lies posterolaterally at the level of tibial tuberosity. Shin is the subcutaneous anterior border of tibia. It is sinuously curved and extends from the tibial tuberosity to the anterior margin of the medial malleolus. Medial surface of tibia is subcutaneous. Great saphenous vein crosses lower 1/3 of the surface, running obliquely upwards and backwards from the anterior border of medial malleolus. Medial border of tibia is palpable throughout its whole extent. Gastrocnemius and the underlying soleus form the fleshy prominence of the calf. Tendocalcaneus is the strong, thick tendon of these muscles. It is attached below to the posterior surface of calcaneum. Medial malleolus is the bony prominence on the medial side of ankle. It is formed by a downwards projection from the medial surface of the lower end of tibia. Lateral malleolus is the bony prominence on the lateral side of ankle. It is formed by the lower end of fibula. It is larger but narrower than the medial malleolus, and its tip is 0.5 centimeters below that of the medial malleolus. The posterior borders of two malleoli are in the same coronal plane, but the anterior border of lateral malleolus is about 1.5 centimeter behind that of the medial malleolus. Sustentaculum tali can be felt about a thumb breadth below the medial malleolus. Tuberosity of navicular bone is a low, bony prominence, felt 2.5 to 3.75 centimeters. Antero-inferior to the medial malleolus, tuberosity of the base of fifth metatarsal bone is the most prominent landmark on the lateral border of the foot. It lies midway between the point of the heel and the root of the little toe. Posterior tibial artery pulsations can be felt against calcaneum, about 2 centimeters below and behind the medial malleolus. Dorsalis pedis artery pulsations can be felt well on the dorsum of foot, about 5 centimeters distal to the malleoli, over the intermediate cuneiform bone. Cutaneous nerves. The infrapatellar branch of the saphenous nerve pierces the sartorius and the deep fascia on the medial side of the knee, curves downwards and forwards, and supplies the skin over the ligamentum patellae. The saphenous nerve is a branch of the posterior division of the femoral nerve. It supplies the skin of the medial side of the leg and the medial border of the foot up to the ball of the great toe. The lateral cutaneous nerve of the calf is a branch of the common peroneal nerve. Supply the skin of the upper 2/3 of the lateral side of the leg. The superficial peroneal nerve is a branch of the common peroneal nerve, divides into medial and lateral branches. These branches supply the following: the skin over the lower 1/3 of the lateral side of the leg, the skin over the entire dorsum of the foot, with the exception of the following areas: lateral border supplied by the sural nerve, medial border up to the base of the great toe, supplied by the saphenous nerve, cleft between the first and second toes, supplied by the deep peroneal nerve. The sural nerve is a branch of the tibial nerve and supplies the skin of the lower half of the back of leg and of the whole of the lateral border of the foot, up to the tip of the little toe. The digital branches of the medial and lateral plantar nerves curve upwards and supply the distal parts of the dorsum of the toes. Deep fascia of the leg. The anterior and posterior intermuscular septa are attached to the anterior and posterior borders of the fibula. They divide the leg into 3 compartments: anterior, lateral, and posterior. The posterior compartment is subdivided into superficial, intermediate, and deep parts by superficial and deep transverse fascial septa. The following points about the fascia are noteworthy. Extensions of deep fascia form intermuscular septa that divide the leg into compartments. The anterior and posterior intermuscular septa are attached to the anterior and posterior borders of the fibula. They divide the leg into 3 compartments: anterior, lateral, and posterior. The posterior compartment is subdivided into superficial, intermediate, and deep parts by superficial and deep transverse fascial septa. Around the ankle, the deep fascia is thickened to form called retinacula. These are so called because they retain tendons in place. On the front of the ankle, there are the superior and inferior extensor retinacula. Laterally, there are the superior and inferior peroneal retinacula. Posteromedial, there is the flexor retinaculum. Muscles of the anterior compartment of the leg. The muscles of the anterior compartment of the leg are the tibialis anterior, the extensor Hallucis longus, the extensor Digitorum longus, and Peroneus tertius. Tibialis anterior. It has spindle-shaped multi-pennate belly. Origin. Upper 2/3 of the lateral surface of the tibia. Adjacent part of the interosseous membrane. Distal part of the lateral condyle of the tibia. Insertion, medial surface of the medial cuneiform. Adjoining medial surface of the base of the first metatarsal. Action, dorsiflexion of the ankle. Inversion of the foot. Extensor Hallucis longus. Origin. Middle 2/4, posterior part of the medial surface of the shaft of fibula. Adjacent part of the interosseous membrane. insertion, base, dorsal surface of the distal phalanx of the big toe, action, extension of the phalanges of the big toe, dorsiflexion of the foot, extensor digitorum longus, origin, takes place from the whole of the upper 1/4 and medial part of the middle 2/4 of the anterior surface of the fibula. Insertion takes place into middle and distal phalanges of the lateral 4 toes by 4 tendons. Action, dorsiflexion of the foot and extension of metacarpophalangeal joint, proximal interphalangeal joint, and distal interphalangeal joints of the lateral 4 toes. Peroneus tertius, origin, lower 1/4 of the anterior surface of the fibula. Insertion, adjacent part of the interosseous membrane, dorsal surface, medial part of the base of the 5th metatarsal bone. Action, dorsiflexion of the foot and eversion of the foot. Clinical anatomy, paralysis of the muscles of the anterior compartment of the leg results in loss of the power of dorsiflexion of the foot. As a result, the foot is plantar flexed. The condition is called foot drop. This is usually caused by injury or disease of the common peroneal nerve due to trauma, leprosy, or peripheral neuritis. That completes our discussion on the front of the leg with dorsum of the foot. See you in the next video.